Have you ever heard of Leishmaniasis? It's a parasitic disease caused by the microscopic protozoan parasites belonging to the genus Leishmania. These crafty little creatures hitch a ride into our bodies through the bites of infected female sandflies. Imagine, something as innocuous as a tiny sandfly bite could lead to such a harmful disease. But where is this disease found, you might ask? Leishmaniasis is prevalent primarily in tropical and subtropical regions, spanning parts of Asia, Africa, the Middle East, Latin America, and even the Mediterranean Basin. So, whether you're trekking through the Amazon rainforest or soaking up the sun on a Mediterranean beach, it's crucial to be aware of the risks. Remember, knowledge is the first line of defense. Now that we know what Leishmaniasis is and where it's prevalent, let's delve into the different types. Leishmaniasis is not a one-size-fits-all disease. This tricky parasite, known as Leishmania, manifests itself in three main forms: cutaneous leishmaniasis, mucocutaneous leishmaniasis, and visceral leishmaniasis. Let's take a closer look at each type. First up, we have cutaneous leishmaniasis, or CL, the most common form of the disease. It's a bit like an unwelcome house guest, making its presence known by causing sores on exposed parts of the body. These sores might take their sweet time to show up, possibly weeks or even months after the initial sandfly bite. But once they're here, they're hard to ignore. Next in line is mucocutaneous leishmaniasis, or MCL. This form of leishmaniasis is like the overbearing relative who doesn't know when to leave. It's less common than CL, but its impact is far more severe. MCL can lead to destructive lesions in the mucous membranes of the nose, mouth, and throat. It's not just a physical nuisance, it can have serious health implications. Last but certainly not least, we have visceral leishmaniasis, also known as Kala-Azar or VL. This is the most severe form of the disease, and if left untreated, it's a real life-threatening situation. VL doesn't limit itself to the skin or mucous membranes. It goes straight for the internal organs, such as the spleen, liver, and bone marrow. Symptoms can include prolonged fever, weight loss, swelling of the spleen and liver, and anemia. It's like a stealthy invader that silently wreaks havoc on the body. Each of these forms of leishmaniasis presents its unique challenges. They all stem from the same parasite, but their symptoms and severity can vary greatly. This highlights the importance of understanding the disease in its entirety, rather than just focusing on one aspect. Given the severity of these conditions, it's crucial to understand the treatment options available. How do we fight leishmaniasis? The answer lies in both treatment and prevention. When it comes to treating leishmaniasis, anti-parasitic medications are the frontline defense. The choice of medication depends on the form and severity of the disease. For instance, pentavalent antimonials, a class of drugs that disrupt the parasite's metabolism, are commonly used. In more severe cases, like visceral leishmaniasis or when antimonials are not effective, physicians may turn to other drugs such as amphotericin B or miltefosine. It's crucial to remember that early diagnosis can significantly improve treatment outcomes. Prevention, however, is equally, if not more, important. The disease is spread by the bite of infected sandflies, so controlling the sandfly population is a crucial step. This can be done through the use of insecticides, particularly in areas where these insects breed. Insecticide-treated bed nets are also an effective preventative measure, as they create a physical barrier between humans and sandflies, particularly during night hours when the insects are most active. Lastly, raising awareness in communities most affected by leishmaniasis is key. Educating people about the symptoms of the disease, the importance of early diagnosis, and the measures they can take to protect themselves can go a long way in preventing new infections. In the battle against leishmaniasis, both treatment and prevention are crucial. While treatment options exist, prevention remains key in the fight against leishmaniasis. Let's quickly recap what we've learned today. Leishmaniasis is a parasitic disease caused by Leishmania, transmitted via infected female sandflies. It's found mainly in tropical and subtropical regions. The disease presents in three forms: cutaneous, mucocutaneous, and visceral, each with varying severity. Treatment involves anti-parasitic medications, with prevention focusing on controlling the sandfly population and raising awareness. Remember, understanding leishmaniasis is the first step in preventing its spread and treating it effectively.